All right, so this is the next part, part 5, I believe, of the lecture video for Chapter 2, Pharmacy Law and Ethics. So we are picking up on slide 27, talking about the Patient Protection and Affordable Care Act, known as the ACA of 2010. So this was a big thing. It was a very controversial act when it was passed, about requiring the citizens of the United States to have health insurance, and then if they did not, paying a penalty at the end of the year. Now we know that that penalty has since been absolved. That is no longer a requirement. They're trying to get rid of the Affordable Care Act, or at least change it in many aspects, but they did get the penalty or the consequence of not having health insurance removed. So people aren't having to pay for that out of their taxes or get penalized on their taxes at the end of the year. So when it was passed, it required states to provide health insurance options to all citizens and provide subsidies based on income level. So essentially providing subsidies for people that are of different income limits, and providing those subsidies to allow them to afford the healthcare coverage. Was designed to increase access to healthcare. So its overall impact on the healthcare system. So it required healthcare systems to form what they call accountable care organizations, or ACOs. And those were designed to study the efficacy of healthcare and mainly focusing on patient outcomes. So one thing that they really looked into, and one thing that was a very positive thing about the Affordable Care Act, was the preventative services, covering preventative services 100%, which includes things like vaccines, your yearly physicals, 1 a year well child check for children under 18, those different things free of charge. The insurance company would cover that 100%. Pharmacists participate in these accountable care organizations, and as technicians, we assist them in that work too. So part of a pharmacist's role is doing the DUR, doing the counseling services, making sure that we're not missing anything. We're making sure that they're getting all of the medication that they need or they should be taking to help their disease states. Nothing that they're taking is going to have any drug-drug interactions, and then, overall, making sure at the end of the day that the patient understands the medication, how to take it, why to remain compliant, and all of those things. The Affordable Care Act also was designed to target fraud and waste, more particularly for Medicaid and Medicare services. So something that CMS was having a huge issue with. So not just people fraudulently getting access, as we call it in Arizona, or Medicaid, but also that there were some providers throughout the United States that were scamming the system and charging more for Medicare patients, so charging the federal government more, coming up with bogus reasons why they were doing certain testing just to get the money. So this act was passed to help kind of alleviate and curb some of that and catch those individuals. So the Drug Quality and Security Act of 2013 is also known as the Compounding Quality Act. So this was actually passed or prompted in passing by a situation that happened in 2012, where a compounding pharmacy was compounding solutions of methylprednisolone that were actually contaminated with fungus or fungal meningitis. It led to the deaths of 64 individuals. And so what was happening was the owner of this facility is doing life in jail. And the pharmacists that worked under him, there was quite a few also were sentenced to some jail time. And so you think, well, why? The reasoning for that is because these pharmacists in that facility knowingly compounded or allowed their technicians to compound these injectable methylprednisolones in an area that they were not using sterile hoods, they were not in a clean room, they were just making it basically on the countertop. And that's how it got contaminated. And so these 64 deaths, that's a lot. That's a very significant number in a short period of time. There was quite a bit more patients who were sickened and did survive, but they had long, lengthy hospital stays. They were on very potent medications like amphotericin, which is an antifungal. It's only available in an injectable form. We make it into an IV bag. That is a $50,000 vial wholesale cost alone. So, it's very potent. It's kind of the last straw medication because of the risks of side effects on the organs. But at this point, these patients didn't have any other option. So this act was passed in response to this to help protect patients from contaminated compounded medication. So we want to make sure that in any facility that anything is being compounded, that they're following USP guidelines for sterile compounding, they're following federal and state laws, and adhering to those very strict guidelines of hand washing, aseptic technique, using clean rooms, and that those clean rooms have the proper pressures and temperatures and all of that to prevent this type of contamination. The other pharmacists involved were charged, and one pharmacist said, well, I was too afraid to say anything, because my boss, I would have been fired or, retaliation. And the federal government did not buy that. And the reason for that is there's anonymous reporting that's allowed. So he could have anonymously reported to the State Board of Pharmacy in their area, anonymously reported to the FDA. So there was avenues for these pharmacists to report what was going on, what they were asked to do, how these medications were being compounded incorrectly in the incorrect environment, and they did not do that. And they had plenty of opportunities and plenty of resources to do that anonymously, and so they threw the book at them as well. This act also provided federal regulatory oversight over small batch medication compounding. States in the USP also oversee compounding. Problems with contamination continue. So the thing is that these acts are being passed. These compounding pharmacies, you really want to associate yourself, if you're looking to work in a compounding pharmacy, or even if you become a patient and you need medication for a compounding pharmacy, you want to look for these that are accredited through the voluntary accreditation, PCAB, all of those different ones, because they're taking the time to make sure that they have the quality assurance plans and policies and procedures in place, things they have to have in order to receive these accreditations. That includes they have to send off samplings, they have to send off those type of things. Doesn't mean that something's not going to get contaminated. No, accidents happen. Staff, over a period of time become complacent and become very, just following such a routine day in and day out. They kind of get sloppy. They kind of try to cut corners, and it's really important that we don't do that. So the Food and Drug Administration is the watchdog agency for public safety. They're responsible for ensuring both the safety and efficacy of food and drugs that are out on the market. They do not have any legal authority over pharmacy practice in the state. So that's important for you guys to understand that the FDA oversees food and drugs. Okay. They oversee the safety and efficacy of both food and drugs. So when you hear of recalls, because we're in pharmacy, we get wrapped up in just thinking that the FDA is associated with just drugs only. No, they're associated with the food that we eat as well and that we consume. So not only do they visit and monitor and inspect drug manufacturing facilities, they do the same for food manufacturing facilities. And so when you see when you see recalls come out on the TV, on the news stations about contaminated lettuce, and there's been a lot of fresh produce over the last couple of years that has been recalled by certain manufacturers, and that's because the FDA has either discovered a contamination within the facility during an inspection, or they start having clusters of people getting sick, whereas the local public health departments, state public health departments, and the CDC start to get involved and track those incidences. So the FDA regulates OTC labeling, so they also oversee over the counter. So remember, the Food and Drug Administration, in terms of drugs, regulates prescriptions, over the counters or OTCs, and homeopathics. Okay. The FDA requires that the over-the-counter labeling that goes on the boxes and the bottles of things that people can purchase in the store over the counter without a prescription, that all of those instructions, the warnings, everything that is listed on the labeling of the box or the bottles is in layman's terms. So as you progress through your program and as you progress into your career, you're going to become very familiar with medical terminology. You're going to have a different form of understanding and being able to read a higher level of medical terminology and medical terms and all of that stuff that's used. But you have to think about our patients. Not every customer coming in has any type of medical background at all. So that's why the FDA is ensuring and overseeing that all of the labeling for the instructions for the patients to be able to use these over-the-counter medications are in layman's terms, layperson terms. They can understand it, they can read it. It's very cut and clear how they take it, what they should watch out for as far as any warnings or indications and side effects. The Food and Drug Administration also requires manufacturers to file a new drug application. So anytime the drug manufacturer wants to bring a new drug to the market, they have to file an NDA or a new drug application. In that, right, so from beginning to end, it takes many, many years for drug manufacturers to bring new drugs to the market. But ultimately, it is a responsibility of the drug manufacturer to prove both safety and efficacy of the drug. They also provide guidelines for packaging, labeling, and advertising. So again, they do not allow drug manufacturers or even over-the-counter manufacturers to say this is a cure-all, this cures all your ailments. You know, they have to be very careful in their advertising. The FDA oversees product recalls, so not just drugs, but food as well. So again, when you are working in a setting, most likely you will be required to, at some point in your career, check for drug recalls that come through. Remember that only the FDA and the drug manufacturer can issue the drug recalls. Typically, the drug recalls that come from the drug manufacturer are going to be voluntary recalls, whereas the FDA stepped in and said no way, and it's a mandatory pulling off the shelf or recalling of the drug. The FDA also publishes the FDA Orange Book, which is actually a giant book. It's online now, and it's a book of approved drugs. And then they have the Purple Book, which is a book of approved biological drugs. So the Orange Book is for all approved drugs, and then the Purple Book is specific to biological drugs. The United States Pharmacopeia Convention, or known as the USP, it is independent. It is a nonprofit organization. They set the standards for drug manufacturing and drug formulations. They set standards in pharmacy practice. They don't regulate it, but they set the standards, particularly for the three that we covered: USP 795, non-sterile compounding; USP 797, sterile compounding; and USP 800, which is compounding of hazardous drugs. Book of Standards is called the U.S. Pharmacopeia National Formulary, or the USPNF, and that is published in hard copy and also online. The DEA, going back to that, this is kind of overseeing all of the different agencies. So the Drug Enforcement Agency, administration, known as the DEA, enforces laws and regulations regarding both legal and illegal addictive substances. We know that the Controlled Substance Act classifies drugs into 5 categories, C1 through C5. It maintains an audit trail of controlled substances that happens. The audit trails from the manufacturer to the wholesaler to the pharmacy to the patient or to destruction. So there is a full line of paper trail. So that's what I like to tell my students, is that, addiction comes in many forms and fashions. There's addiction just does not happen to the poor, and those that don't have education. That's a myth. Addiction happens to every person in every walk of life. So I have a risk of addiction. Everyone has a risk of addiction just because of the potency of these medications. And a lot of times it starts as simple as they've been in a car accident, or maybe they've injured themselves hiking or jogging, and they start those medications. That's how quickly and how easily patients can get addicted to these medications. So, you can have pharmacists, you can have doctors, you can have anesthesiologists, you can have any person from any walk of life get addicted to these substances. So I like to tell my students that that's how easy and how quickly something like that can happen, and just to avoid the temptation. I've worked with technicians and pharmacists in the past who have been in trouble for stealing narcotics. It is not a pretty thing. You will go to jail. You will lose your license. You would have wasted your schooling. Pharmacists especially, 6 years worth of schooling and over $100,000 in school debts to finish their program is just not worth it. And the reason for that is the paper trail does exist. You may not get caught in the first 3-4 days that you've done it. You might get away with it for a year, but it will eventually catch up to you. There is a paper trail, and you will leave your fingerprint behind without you even knowing it. The DEA also requires registration for all individuals, institutions, and businesses involved in controlled substances. So again, physicians, veterinarians, nurse practitioners. So there's different types of prescribers that must register with the DEA and get a DEA number if they are going to write for controlled substance prescriptions. Pharmacists, individual pharmacists, do not need to get a DEA number. They work under the facility's DEA number. So if they work at Walgreens or Walmart, each individual store has their own DEA number. They register so they can dispense the controlled substances. They also determine and monitor which practitioners can prescribe controlled substances. So certain prescribers have free reign, C2 through 5, and certain only have 3 through 5. So it just depends on what type of practitioner. It also limits prescriptions to legitimate medical purposes in the course of pharmacy practice. So, you're not going to see a physician write for marijuana. It's just not going to happen until it goes until it's approved with a medicinal use through the federal government. And then it would change from a C1 to a C2. The DEA also tracks drug trends within certain states. So they look at drug trends in counties, in states, and they start monitoring that to see kind of where the hot spots are. Because sometimes it's not just individuals, drug seeking and getting prescriptions from a lot of different physicians. There's a lot of corrupt physicians out there that, we had one here in town in particular around the 2009 time that ran a very shady operation down on the south side of town. He accepted cash only. He pretty much gave patients a diagnosis to write for large quantities. We're talking 150 to 300 Oxycontin, oxycodone, Percocet tablets in a month. And so these patients were addicted, or they were selling them. They would pay him cash, and he would write the prescription. So it's not just the drug addicts themselves. They're also monitoring to make sure, because there are some corrupt physicians and other pharmacists and individuals. So the National Council for Prescription Drug Programs, so the NCPDP issues identification numbers to pharmacies. They are used in insurance transactions. It's used in e-prescribing and then exchanges of health information. It also issues identification numbers to pharmacists who need to bill for their services. So, for example, if a patient comes in for an immunization in your retail pharmacy, so let's say they're coming in to get a pneumovax for pneumonia, or they're getting a flu shot or anything like that, the pharmacist is the one that's administering that vaccine, so they have to have an identification number to be able to be reimbursed for their services. Okay. Last piece we're going to cover here on slide 37 is the National Association Boards of Pharmacy, known as the NABP. This professional organization develops the National Pharmacist License Examination. It also coordinates the reciprocation of pharmacists practicing in other states. So what it does is, when one pharmacist decides to move, they've gone through pharmacy school in Arizona, they passed their Arizona board exam, and they're wanting to move to a different state, the NABP will provide that reciprocation for them. They will help them with figuring out what tests they need to take in that other state. Every state is different, okay? It verifies the licensure of online pharmacies for the state boards of pharmacy. So there are online pharmacies, and the NABP actually verifies those for the individual state boards. It provides a model of pharmacy practice standard for the state boards. So they develop a model of what the standards should be for how pharmacies are practicing, what their policies and procedures should be, and they offer those to the different state boards as kind of a map or a blueprint on what the expectation of the pharmacy should be. It has no regulatory authority, so that's important to make known here, that the NABP does not have any regulatory authority over the pharmacy, so nothing like the FDA or the DEA has. It operates an accreditation program for internet pharmacies. So again, it's a way for these pharmacies, especially if they're an online pharmacy, to receive that additional accreditation to show that they are doing things in a legitimate light. So we ended there on slide 37. You have an assignment for today. Go ahead and get that done. If you have any questions, be sure to email me or you can call me. Have a good day.